All right, I'm here with my patient Mo today, and Mo's been with us a few months now. We've been treating him for some really nasty pain that you came in with that was in your arm. And why don't you just talk a little bit about what brought you in to begin with?
Well, I went on a trip and I came home, and then on the way home I realized I was having some real bad shoulder and neck pain, and it got to the point where I couldn't sleep, couldn't get comfortable, couldn't do anything, and finally decided to give a doctor a call. Came in and saw it, and been through some different motions and stuff like that, different therapy and stuff, and I can say now it's at least almost 100% better, if not, right there. So
Yeah, absolutely.
I'm definitely a lot happier with it, that's for sure.
I know initially when you came in, I think I saw you Saturday and Sunday.
It was Friday, Saturday,
Yeah.
Sunday, Monday, and then Tuesday, right in a row.
Yeah, we took you off work, and part of the problem that you had some radiating arm pain, so you had, and remember, you couldn't hardly move your neck at all. It was very, very painful. So even when we just initially started treating you, it was really a slow-going process because you were so fired up that doing anything with you was almost impossible.
Right.
Okay, so we had to be really passive initially, and before we could even get you onto the spinal decompression table.
Yep.
The other thing is that Mo does body work, so he does this repetitive motion all the time when he does his sanding. So what we found were there were some sites on the muscle in the arm that had some old trigger points from the repetitive injury that you had, and that was contributing as well. So we did some active release therapy, which is when we put you through the motion and we work on the muscle. We've done a lot of that, and that's been helpful. We've done the spinal decompression, we've done the oxygen, we've done some interferential, we did some laser, I think, at the other office
did some
too.
laser,
And really the difference is pretty amazing.
Yeah, I'm impressed.
From before and after. So a lot of people are afraid whenever you say decompression and they see that machine, it looks kind of scary. It looks, you got all these moving parts, and a lot of people are concerned if they go to the chiropractor that it's going to hurt.
Yeah.
That the treatment will be painful or that the decompression will be painful.
Start out slow and just work it up. It was fine with me. I feel better after I get out of it too. So helps you breathe and helps you move for sure. So
yeah,
definitely
help
my
with the
arm
pain.
movement back. I mean,
which you need for work, right?
Yeah.
Right,
and
and riding your motorcycle.
Yeah, that too. So kind of hard to give a gas if you can't use your arms. So.
You're right there.
But definitely.
So
definitely
would you recommend this type of care to someone who was suffering with the same type of?
Oh yeah, definitely.
Excellent.
100%.
Great. Well, you know what? Part of the success of any patient's care plan is the willingness of the patient to be here when they're supposed to be here and do what they need to do at home. And you've been really, really super good about keeping all of your appointments. And I know that you follow my instructions. If I tell you to do something at home, you do it, and that makes all the difference as well.
And it helps. It makes it better quicker. So.
I went